Nicaragua. Can you describe to our viewers what global burden of disease is?
So a global burden of disease is a measurement of the calculated number of death, disability, and disease of the world's population. There are two ways to measure a country's state of health. One is health-adjusted life expectancy and disability-adjusted life years.
What will you and your researchers be talking about today?
We will be discussing Nicaragua and specifically its leading causes of morbidity and mortality. Right now, they're currently in stage 3 of their demographic transition.
What is Nicaragua's health system like?
Right now, Nicaragua has shown work in strengthening its health system, yet there are still many issues that still need to be addressed and resolved. Although Nicaragua is the largest country in Central America, it is arguably the least developed, especially in overall health. It is still facing many difficulties in regards to accessing valuable health care.
What are the highest causes of death in adult and child populations?
So for children under 5 in Nicaragua, it is prematurity, and for adult populations, it's ischemic heart diseases.
And what are Nicaragua's key health issues?
We will be discussing ischemic heart diseases, chronic kidney disease, and lower respiratory infections.
What are the biggest concerns with ischemic heart disease?
Well, one of the biggest burdens of disease in Nicaragua is ischemic heart disease, with having 3,296 deaths of those between the ages of 15 and 59, and 344 deaths in those over 60, all in 1 year. The World Health Organization has recorded a DALY score of 1,036, which is a level 3 on a scale of 1 to 4, with 4 being the most concerning.
How might Nicaragua improve these issues moving forward?
For Nicaragua to improve its DALY score and overall health, it is important that moving forward they implement community initiatives towards a more active lifestyle and healthy eating initiatives to improve all over heart and body health.
What are the biggest concerns with chronic kidney disease?
Chronic kidney disease in Nicaragua is very prevalent. It has risen from 6th place in 2005 to 2nd place in 2016 for being a leading cause of premature death, and that is an increase by 50%. It is also the 2nd leading cause of DALYs in Nicaragua, as shown in a 2016 study.
What populations does it affect?
So the population that is being most affected by chronic kidney disease are the Nicaraguan agricultural workers, such as those who work long hours in the sun on sugarcane farms. Usually these are young to middle-aged men.
And what needs to happen to help solve this issue?
Something that needs to become available to Nicaraguan workers is safe drinking water. So this can be done through government funding to create water purification processes. Another thing that's really important to help the affected populations is improving working conditions, and this will require the government to provide resources that are needed to achieve this.
What are the biggest concerns with respiratory infections?
Well, 2016 studies found that 39 million people had been affected by lower respiratory infections, and that's affecting about 3.2% of the population. And despite these numbers decreasing, it still remains high on the list of causes for mortality and morbidity in Nicaragua.
What does Nicaragua need to do to solve this issue?
Well, the situation of households, especially in Nicaragua, are the perfect recipe for contracting these infections. And the first thing that Nicaraguans need to do is to increase public health expenditure on ventilation systems as well as cooking methods, because one of the main causes of these lower respiratory infections are the bad ventilation systems combined with the cooking methods. And it was found that 59% of households still used firewood for cooking. One of the methods that would help would be to replace these firewood cooking methods with gas or electric stoves, as well as to implement better ventilation standards. In addition, it would be beneficial if the government took initiatives to raising awareness to the detrimental effects that these cooking methods have on women as well as young children. And though these new implementations might be expensive and increase living costs, in the end it will be beneficial to everyone, the government as well as the citizens.
Very true. Thank you. How will the implementation of these plans improve Nicaragua's overall health?
The health of Nicaragua's population would surely benefit with better access to quality healthcare services, better education, access to clean water, and improved sanitary standards. This action plan will bring the country closer to being established as a developed country reaching stage 4 of demographic transition by increasing the population's overall public health and decrease the global burden of disease.